Welcome to Psych Talk for primary care providers, where our esteemed faculty members will provide you with invaluable insights to seamlessly integrate into your daily practice. Today, our guest is Dr. David Karol, who talks to us about delirium, how to detect it, and what to do once delirium is diagnosed.
Hello, I'm Dave Karol, and I'm going to talk to you for the TNT program, the fellowship, about delirium. So delirium is a condition that often is seen in the hospital, not so much in the clinic, but it consists of an alteration in an acute change in mental status, and typically with problems with attention and awareness that can occur, but also problems with disorientation, problems with perception, visual disturbances, for example, and problems kind of remembering, having memory problems. So what causes it is not really clear. There are neurotransmitter theories and inflammatory cytokine theories, but we do know that there are several risk factors that are associated with delirium. Being older is associated with delirium, having pre-existing cognitive impairment, having a major medical illness or surgery like cardiothoracic surgery or a hip fracture can predispose you for delirium. So how do you detect it? So again, kind of the first subtle clues are going to be a decrease in the patient's alertness. They may be a little drowsy. They may not be attending to the conversation very well, and they just may seem kind of out of it, for lack of a better term. And it's important to that you determine that this is an acute change. What I tend to do when I'm suspecting delirium is I kind of back up. If I'm asking them questions and I'm like, okay, they're not really following or whatever, I said, well, let me ask you some questions. Some of them are harder than others, but I just want to ask you this. Can you tell me exactly where you are right now? And I ask the orientation questions, and then I ask them to remember 3 words. I pick 3 objects. I usually do apple, table, and penny. Pretty easy to remember. I've been doing that since medical school. Ask them to repeat them, keep them in their head, and then I do have several other tasks. I have them spell world backwards, say the months of the year in backwards order. And then finally, some simple math. I usually say, if I handed you 9 quarters, how much money would you have? And then I come back after they answer those questions and say, okay, what were those 3 objects I wanted you to remember? And usually about a minute or so has passed. And I see if they can recall that. Any errors in those questions should raise suspicion for delirium. So once you are concerned for delirium, obviously, if you're in the clinic, they should get to a hospital or emergency room, because it's usually a sign of an acute medical illness. And the common things that can cause delirium include medical illnesses, like I said, like infections. Urinary tract infections are pretty common. Pneumonia, skin and soft tissue infections like cellulitis, and bloodstream infections are common infectious causes. Medications are a big one, especially medications with anticholinergic side effects. Substances, either being intoxicated or withdrawing from substances, can cause delirium. And then finally, electrolyte or metabolic disturbances can be a problem when you have either high or low glucose, or high or low sodium, or an elevated BUN. Someone who may be having an acute kidney injury could be delirious as well. So obviously, it's something that needs acute attention and typically should be cared for in the hospital. That being said, you may be taking care of people in the clinic who've recovered from delirium, and it's important to know that to pick up on some of these subtle signs. And people who do have delirium, unfortunately, are at higher risk of permanent cognitive impairment, and decreased ability to function, and increased mortality. So if your patient has had delirium, certainly it's important to detect it. But if they've had the patient and you're now taking care of them in the clinic, it's important to check in on their functioning as well.